Hi there, I'm Dr. Ron Brown, Medical Director of True Balance Hormone Therapy Clinic, and I would like to welcome you on your journey for hormone restoration. True Balance has been involved in hormone restoration or hormone therapy since 2007. I'm an OB/GYN and was challenged by a patient in regards to something called bioidentical hormone therapy back in 2006. I ended up going to a conference down in the United States in Denver and had my eyes opened wide as to some of the possibilities that are there with hormone replacement therapy. Since then, we have developed the largest hormone therapy clinic in Canada and likely in North America, and I'm very happy to have you join our list of patients. People ask how I got involved or how True Balance got involved in testosterone replacement therapy, or what I'm going to refer to as TRT from now on. In 2007, I started a program of bioidentical hormone therapy, which was primarily for women, and as an OB/GYN, that fit perfectly into my background. The difficulty that I experienced was women are natural sharers. That means if they experience something in their life that works for them and that makes them feel better, they will naturally talk to a number of friends and family, and then usually drag in a male partner in order for their partner to feel as good as they feel looking at hormone therapy. So there I was in the uncomfortable situation of an OB/GYN starting to treat men with TRT. As a result, I had to go down to the States, did a fellowship in Functional and Regenerative Medicine with the American Academy of Anti-Aging, and learned the pros and cons, ins and outs of testosterone replacement therapy. What's been quite remarkable is that over the course of the last 15 years, this aspect of True Balance hormone therapy has dramatically increased. When I first started, we were 100% bioidentical hormone therapy, which is primarily or only for women, and now we're easily 50-50 with TRT representing easily 50% of what we do, and certainly even a little bit more than 50% of new referrals coming to True Balance. It's been very interesting over the years to watch the change in the discussion as it relates to testosterone replacement therapy, or TRT. Early on, when we started doing TRT 15 years ago, it was all about guys with erectile dysfunction and could we get their erections better, last longer, be harder, so that they could continue having intercourse. What I've noticed over these 15 years is the discussion about this has really changed to quality of life and something called functional capacity. So think of functional capacity as the amount of muscular strength and energy and cognition that you need to live unassisted at home. As long as your functional capacity is above a baseline level, you can live on your own. Once your functional capacity goes below that, then you need help with activities of daily living and you need assistance. I've always believed, for me, quality of life remembers who I am, who my loved ones are, and the ability to live unassisted at home. I don't want to be in a care facility. I don't want to be cared for when I can't remember who I am and who my loved ones are. And so people are starting to recognize that TRT improves functional capacity, improves quality of life, and allows men to live longer unassisted at home. And most importantly, we're starting to understand just how powerful testosterone is as an anti-inflammatory. When you look at your life, if you're in your 40s or 50s or even late 30s or 60s like me, you remember back to your early 20s and you could do anything. You could party all night, you could work all the time, you could burn the candle at both ends. And why? Because you were bathed in a mixture of testosterone coursing through your body. And what we now recognize scientifically and medically is testosterone is a very powerful anti-inflammatory. It acts in every one of your 10 trillion cells in your body. It attaches to DNA in that cell and causes genes that reduce inflammation to turn on or upregulate, and it suppresses or downregulates genes that produce compounds that increase inflammation. Almost all of the chronic diseases that we encounter nowadays, like diabetes, heart disease, high blood pressure, Alzheimer's, and cancer, are all related to increased levels of inflammation. So I believe testosterone therapy is a foundational stone, just like DHRT is in women. TRT for men is a foundational stone of a longevity and quality of life program. So people often ask what men are candidates for TRT and what can it help with. And a simple way of discussing this is going over what are associated with the andropause. And I realize now I should really explain the andropause and contrast that to women. So women go through something called the menopause. So around the age of 50, their periods basically stop. They stop producing hormones of almost every type, estrogen, progesterone, and testosterone. Their periods stop, their hormone levels go down very quickly, and they experience all sorts of problems as far as hot flushes and flashes, vaginal dryness, poor sleep, anxiety. That's called the menopause. In men, it's a completely different process. So in men, basically testosterone levels start to slowly and gradually reduce after the age of 30, and they slowly and gradually reduce until you die in your 80s, 90s, or when you're 100 years old. So that's the process of andropause. It's very slow, it's very subtle, there's no significant milestones that make people understand or make people realize something's happening. But even more importantly than that, there are other things going on that we as a society and us as a medical institution don't really understand. And what I mean by that, there was a fascinating study done. I started in 1945. So 1945 was the end of the World War II. And some investigator got the idea that he would take blood samples of 10,000 young, healthy military recruits and then throw all those samples of blood into liquid nitrogen, waiting for a time when it would be possible to assay blood work for testosterone, estrogen, progesterone, all the sex hormones, because at that time it was not possible. So in 1945, you couldn't measure serum testosterone if you wanted to. These 10,000 tubes of blood sat in liquid nitrogen for almost 60 years. Then someone in 2006 decided, hey, we now are able to measure all these hormones. Why don't we thaw the 10,000 specimens and run them against a sample of 10,000 military recruits in 2006? So you're basically comparing apples to apples. So they did that, and what they found is in 60 years, young, healthy men's testosterone levels declined by more than 50%. So what we have nowadays, on top of men that are declining naturally after the age of 30 with a slow and gradual decline, we have environmental factors like chemicals, herbicides, pesticides that are further accelerating that decline in testosterone function, and I think amplifying the effects or the symptoms of andropause. And the symptoms of andropause are afternoon drowsiness or the need to sleep after supper, low energy, poor muscle mass, low drive, often depression, and problems with erectile dysfunction. So those are the main category of symptoms that males have. Further to that, there's one other important concept that I think men need to know. When you're young, when you're in your teens, early 20s, my concept is that there's two main groups of men: a low testosterone group of men and a high testosterone group of men. The low testosterone guys are the guys that can be friends with the girls in high school and university. They're friends, there's no other pressures, everyone's just great. High testosterone guys are chasing every skirt that comes across their field of vision. So they're not looking for friends, they're looking for a bed companion. And that becomes your natural set point. So flash forward 20 years later, if you were a high testosterone guy at age 18, and now because of environmental factors and your natural declining hormones, you're now a low testosterone guy, you're sitting around at age 38 going, where's my mojo gone? I remember what it felt like to chase every girl I came in contact with, to now where I couldn't care less, and I'm like one of those low testosterone guys back in high school. If you were a low testosterone guy and now you're still a low testosterone guy, it's sort of same old, same old. There's no big difference. And we typically, I believe, see the men that were high testosterone when they were young and now they're low testosterone. So they know they're missing something. They don't know what they're missing, but they know they're missing something. And for a lot of our clients or patients, the missing ingredient is testosterone. A lot of people ask, well, why should I go to True Balance? What makes them the #1 source for TRT? And I believe it's based on the fact True Balance and I have developed a program over 15 years of trial and error, lots of research, lots of reading, conferences and whatnot. And we have a program that quite frankly works, and it works well. Well, why does it work? It works well because we start off with measuring. We don't guess at your testosterone levels. We measure your free testosterone levels. We measure your estradiol levels, DHEA, insulin, glucose, cholesterol, a whole bunch of things. So we know where we're starting from. In the early days of True Balance, I, under the direction of how I was trained at that time, used a lot of transdermal creams for men, meaning testosterone creams you would rub on your arms, your legs, your stomach, wherever. The problem with that was absorption is very unpredictable. Some men absorb well, some men don't absorb at all. The measurements of testosterone when it's applied to the skin is quite problematic. Early on in True Balance's course, we had a very accurate measure of free testosterone done by something called equilibrium dialysis. That was canceled after about 5 years, and we are unable to assay or measure free testosterone with equilibrium dialysis. The labs went to a new test, far less accurate, and it made the measurement of men on cream even more of a problem. So easily 10 years ago, True Balance started switching to injectable forms of testosterone, and that's proven to be a game changer. I personally have used testosterone for more than 15 years, so I'm definitely eating my own cooking, if you know what I mean. I, at age 64, have the energy and functional levels of a 42-year-old, because I remember what I was like when I was 42, and it's completely on the basis of my testosterone therapy, because over the course of those 15 years, experiencing some kind of magical thinking, I decided that at some point in time I had quote unquote cured myself, and I went off testosterone, and all the symptoms would come back until the point in time when my family would say, hey, you're back to being low energy, grumpy, and not feeling your normal self. Please go on your testosterone. And I really want to emphasize, there was a set of movies called Grumpy Old Men, and sometimes Hollywood is really good at hitting the nail right on the head. Everyone thinks of testosterone as the rage hormone. You get that stuff, you're going to go psycho, start to do carjackings and all that sorts of other things. That's not the case. In fact, low testosterone creates grumpy, miserable old men. One of the common questions that people have is, well, does TRT increase the risk of heart disease or cancer? We categorically know that TRT reduces the risk of heart disease. It's been well shown, and in fact in Japan, if you show up with a heart attack in emergency, they will give you intravenous testosterone because it's been shown to vasodilate the heart blood vessels and minimize the amount of damage to the muscle in the heart. So Think of testosterone as an anabolic pro-muscle hormone that helps with muscle mass when you work out and exercise, but also helps your heart and definitely does not accelerate heart disease. In fact, it slows it down. The other really surprising fact is, for some reason medically, testosterone therapy was always linked with an increased risk of prostate cancer. In fact, some people would say if you had prostate cancer, giving TRT is like throwing gasoline on a fire. And in fact, nothing could be farther from the truth. And if this is pertinent to you because of your past history, I strongly recommend a book called Testosterone for Life. It's a simple book written by Dr. Abraham Morgentaler, a Harvard urologist, who discovered where this erroneous concept of testosterone increasing the risk of prostate cancer came from. And it came from a study of 3 guys in 1945, and only one of them should have been truly involved in the study. So an entire several generations of men were treated or not treated with TRT because of this worry about prostate cancer, where it turns out one of the main risk factors for prostate cancer is, you guessed it, low testosterone. That's why you don't see any men in their 20s and 30s with prostate cancer, and yet a high proportion of men in their 80s and 90s have prostate cancer. Testosterone protects against prostate cancer. As your levels decline, your risk of prostate cancer goes up because low testosterone is a risk factor for prostate cancer. That's one of the reasons why all the men coming to see us, we do a PSA as part of the workup, because I again want to know where we're starting. I recognize that PSA is a very imperfect test, but it's the best we have now until something new comes along, so that's what we're going to use. So men often ask, well, what's the process? I've watched this video, you've hit some of the highlights, this makes sense to me. I've maybe read 1 or 2 books and I want to do this. What do I do? The way to get started is to email or phone True Balance, go onto the website, make contact, and have a requisition for a blood test sent out. Once your blood is collected and we get the results, then an appointment can be made with one of our hormone specialists, and you will, as I said before, have a 1-hour in-depth interview with a hormone specialist in conjunction with one of the medical practitioners or nurse practitioners that works with me. We have a highly specialized, highly educated team that know everything inside and out as it relates to TRT and your past and current medical conditions. After the course of the hour, looking in conjunction with your symptoms, your blood work, and your past medical and current medical history, a treatment plan is designed for you, prescription is faxed off, you start the process. As I said before, I'm a big fan of injectable testosterone. I inject myself once a week. It takes me literally 1 minute once a week, and that's the summation of the hassle of my program. So it's very simple, it's very easy, and what I like about my system, and the reason it's designed that way, is then 8 to 10 weeks down the road, we do follow-up blood work for the things that we're interested in, plus anything that might have showed up on your initial panel that we're interested in following through and seeing if all of these are heading in the right direction. For instance, I mentioned blood glucose and diabetes. In a functional medicine perspective, the #1 treatment of male diabetics is testosterone therapy. Their blood sugars will improve, their muscle mass will get better, and they will in general require less diabetic medications than without testosterone therapy. I'm really excited that you're watching this video. I'm looking forward to having members of our team take care of you, and trust that we can move you towards an area where I just want you to be able to show up as the best version of you in life every day, enriching the lives of your friends and family, and having improved quality of life. Thank you very much and have a great day.